Hey, it's Dr. Murphy. So I wanted to fill you in on the new cholesterol guidelines that were just released 2 weeks ago by the American College of Cardiology and the American Heart Association. So the last set of guidelines was in 2018. So we're now 8 years later. We have new and improved information. Some of the big changes is there's a new calculator that we can use to predict your 10-year and your 30-year risk of heart attack and stroke. Like the old calculator, there's four different groups that risk will put you in: low risk, borderline, intermediate, and high risk. If you're low risk, we'll still just focus on lifestyle changes like eating healthy, exercise, and maintaining a good weight. If you're borderline, there's some extra testing we can do to see if you have other risk factors for cardiovascular disease. If you're intermediate or high, that's when we look at using medication to help you. So, for the borderline group, I want to talk with you about those other risk factors that you may want to discuss with your primary doctor and see if that would be appropriate for you. And before I go into those extra testing, I want to remind you to please like and subscribe to the channel so we can keep providing you with good information. So, when you go talk with your doctor, there's three blood tests that you want to discuss. That's the LP little a. That's a genetic marker that puts you at a high risk of heart attack and stroke if you have elevated levels. We do tend to see higher levels in people who are Black or of African ancestry, also South Asians and Filipino. So, LP little a, get it checked at least once while you're an adult. If it's high, there's not many things you can do to change that, even if you eat healthy and exercise. So it's really going to take medication in the future that they're currently working on to get those levels lower. Number two, ApoB is another blood test, and that tells you how many of those bad particles you have that puts you at a higher risk of clot and blockages. And the LDL kind of estimates that, but if you get the direct ApoB level check, that will be more accurate for you. Number three, the blood test high sensitivity CRP. That lets you know if you have chronic inflammation in your body, which puts you at a higher risk. So discuss those three blood tests and also talk about the coronary artery calcium score. That's a CT scan that uses low radiation. You don't need an IV. It looks at how much hard plaque you have built up in the arteries around your heart. So if you're someone who's borderline and not really sure if you want to use medicine or just work on lifestyle, and you get this coronary artery calcium score and it's positive and not zero, then that may sway you more one way versus the other. That test right now is not really covered by insurance. So on average, it costs $150 out of pocket if you want to get it done by paying on your own. So those are some key things to be sure you talk with your doctor to give you a better full view picture of what your true risk is of heart disease and stroke. Thank you.